It is time to come clean about the treatments and procedures and things that I have done to my face and my body. Whenever we talk about aesthetics or medical aesthetics, some people think of over-the-counter treatments and procedures like at-home microneedling or LED, or some people immediately jump to things like Botox, Fraxel laser, liposuction. And although I've spoken about all of these things throughout videos over the years, I've never done a video speaking about the treatments that I have and have not gotten done, and the reasoning behind why. I do feel that it's nobody's business, but I do want to make it your business. And when I was younger, struggling with severe acne, trying to navigate the modeling world, I felt so terrible about my body. I thought I needed liposuction, I thought I needed a nose job, I thought I needed my ears pinned, like we've spoken about this before. And comparing myself to other people in society or taking a word that somebody said as a passing comment and turning that into an insult, it destroyed me in a lot of ways. And I'm really glad that I did not undergo specific surgeries or procedures, even though I was told that I needed a nose job to get a job at a plastic surgery clinic, which is another story for another day. But there are things that I have done, especially when it comes to my acne, or yes, a couple things to my body. And I do feel it is important to speak about those things so that for anyone else who's feeling insecure about their body or is just curious and wants to know, we can have an open conversation about that. Should we start off with the face or the body? Maybe the body, because there's like less things, I guess. As noted, I thought for a time that I needed liposuction. I felt that my butt was too big, that my thighs were too big. Even when I was a relatively thin frame, I had and still have cellulite and stretch marks. And I judged myself so badly for that. One of the first body treatments that I ever got done was endermology. And it's actually done in aesthetics and in medical aesthetics. And it's basically this machine that like sucks on your leg. It's aimed to reduce cellulite and sometimes stretch marks. For me, I don't think it made a huge difference. This was about 15 years ago at this point. And it was when I was in aesthetic school learning about advanced treatments and procedures, I actually opted in to get this treatment as a patient or as a client. Now, I don't think it did a lot other than feed my insecurities about my body at the time. And because I was exercising and eating, I didn't feel like I had issues with my body. But in retrospect, when I look back, it is very hard to grow up as a woman or a man or a non-binary friend and not feel judged by society for the way you look. We all have those insecurities, right? But that was something that I thought was going to fix all my issues, and guess what? I've still got cellulite, I've still got stretch marks, and I feel good about them now. And total transparency, I use like the Versed retinol body cream, I use retinoids, I use caffeine creams. That's what I do for any stretch marks or cellulite, and I really don't let it get to me the way it used to. Now, there was a time that I also thought that I needed liposuction. Now, there are many different forms of liposuction, but it's essentially sticking a cannula or like a large needle into the body and removing adipose tissue or fat tissue. I have assisted in liposuction on others. There's things like mommy makeovers and like tummy lifts and things like that. I've especially assisted in kind of post-care in those areas and scar care as well. But I have never gotten liposuction or liposuction in conjunction with something like radiofrequency. Did I consider it? Yes. After seeing some of the complications and actually helping with people who were struggling through things, and then just watching these gorgeous, like beautiful women and these new moms get this procedure, and then their body is changed and looks different, but they still come back and they still have their insecurities. I was like, wow, this is like a temporary band-aid, or at least that's the way it seems sometimes, right? And a lot of people still had the insecurities even after that treatment. And so I thought to myself, first off, I didn't have the money. This is a super invasive procedure. It was just something that I kind of came to the realization that I don't want to hate my body, and getting liposuction was not going to be the answer to that. And I definitely feel like there are areas of my belly that, you know, as a model, I learned to suck it in, but like there's a little IBS, there's some stuff going on in there. But it's also like our bodies carry us throughout the day. These bodies allow us to run and jump and hug and express ourselves. Like this thing could literally create other tiny humans. Why am I gonna hate that? I have considered a hysterectomy because of my debilitating period cramps because I have 2 uteruses. That's another story. I chose not to get liposuction, and I'm kind of happy that I didn't. Now, on the flip side, I did try cool sculpting. Cool sculpting was a treatment we were offering in clinic and that I basically tried, and I don't think it went very well. It wasn't terrible. It wasn't majorly uncomfortable. Cool sculpting is less invasive because as liposuction actually goes into the skin, cool sculpting basically freezes the tissue and then your body breaks it down. And I think I did like 3 to 5 treatments. I can't remember if I actually did all 5, even though I think I paid for all 5 of them. But I specifically did it on my stomach and on my thighs. I don't think I've always felt insecure, but like since the modeling industry, I felt really insecure about like this area. Basically, runway casting in Italy told me that I was too large in the butt area, and it stuck with me. And now I'm like, bitch, My brain may be lacking, but my ass is packing, and nobody's gonna make me feel bad about it. I love that social media likes big butts again, but anyways, that was cool sculpting that I did, and I didn't love it. I guess maybe if I kept up with it more, it would create some differences, but I am someone who loves hiking. I love swimming in the ocean. I am a personal trainer and nutritionist. I am not a dietitian, however, but I've studied and assisted in sports medicine and emergency medicine, among other things. Learning about the body has really taught me so much about it and how to care for it, and I feel like that, for me, has done more than cool sculpting and endermology ever did. Now, maybe I'm delusional. Maybe cool sculpting transformed my body and I just didn't see it because I was so hyper insecure, but I really think that it was my lifestyle choices and just remaining active and trying to be healthy and like building muscle at the gym. I think that that went way farther than cool sculpting did for me personally. Now, that doesn't mean that it's not the same for others. And again, if people do have specific conditions like PCOS, or if people have a specific area that they consider a problem area that they want to work on, something like cool sculpting or liposuction or body contouring, like that can be absolutely wonderful for the right person. Although for me, I think I was doing it more on my insecurities and trying to match society versus transforming my body into something that I wanted it to be. Speaking of bodies, we gotta talk about boobies. Never did anything to my boobies other than like searched for lumps for like, you know, breast cancer. I have had a couple of cysts in my breasts, but never actually got implants. Again, there was a time that I kind of thought I needed implants because I was kind of teased for having a small chest when I was like in the 6th grade. But it's like, first off, like kids, so mean. And then as I got older, that was just actually something I never really wanted. And I was like, hey, I got these. I don't need to wear a bra. I could wear a push-up bra if I wanted to. Why am I gonna feel bad about it? Specifically on the body, I have done different hair removal techniques, but I have not done laser hair removal in clinic, even though again, I've assisted with people, especially people who've gotten like burns to the skin, especially when it comes to like electrolysis. But IPL is my favorite. Again, I've assisted with it professionally. I've never done professional IPL on myself. I have on others, and I've helped a lot with that. But on myself, I have not. I have used the at-home things. I was using Mackenzie for quite a while. Mackenzie kind of got grody. This is nasty. Like, it is gunky in here. You can literally see like a ring around the light of like my skin gunk. It's still working. I haven't had major issues with it, but I am now testing the YouLike, which is, I feel like it's much more professional. It's like a little sapphire device and it's actually cooling on the skin instead of warm, and I am testing that out. I really like it, and that is what I have been doing. I have also, of course, waxed both myself and others. There are some very embarrassing videos from like 11 years ago when little SD bestie Cassandra decided to wax her hairy armpits in the kitchen. That video got like 2 million views. I'm so embarrassed. But I have done many different hair removal techniques. At this point, I haven't done any of those hair removal techniques on my face. I've done waxing and tweezing, but you know, nothing like major or invasive. And I've never gotten Botox in my armpits, which, fun fact, some people who are worried about body hair are also worried about oil or sweating. And you can actually get Botox, or basically these neurotoxins, injected into the armpits or into the hairline to actually help with oil production and with sweating or hyperhidrosis, basically excessive sweating. Now, I have never done Botox. I have chosen not to get Botox. Have I considered it? Sure. I specifically have a very gummy smile. You can see that my Rosaurus muscles are they're buff. I got some buff muscles on my face, okay? And for the longest time, I felt like, oh my gosh, like 3 to 5 units on each side. Just, I am still considering it. I would do it, especially because Botox wears off, but would I ever do it for like, you know, my glabellar complex or these, you know, frontalis muscles? I don't know. If I ever do Botox, or again, Xeomin or Dysport, depending on which one you want and how you want to call it, I think I might consider it, maybe like in my gummy smile, or kind of, you know, for tension headaches and for like jaw clenching back here, but it is something that I haven't done yet on myself. I don't know if I want to, right? Botox does wear off. It's not permanent. It is a muscle paralyzer that your body basically reabsorbs over time. But you know, Botox, Xeomin, Dysport, I've seen a lot of people get it and a lot of people like it. You do have to maintain it and keep up with it. And for me, I feel like my chemical peels or the potential laser, that for me, I feel like would be much better for fine lines and wrinkles and just like using my sunscreen and my retinoids. So I have not used Botox at all at this point. And if I do, I don't know if it's right for me for wrinkles at this point. Speaking of injections into the face, a lot of people do get things like Kybella. Again, you can also get that like in other areas of the body, but specifically like for the chin or the jaw. I've never gotten any injections or like fat reduction on my face, at least not from injections. Again, we're going to talk about things like radio frequency and like tripolar and lasers in just a second. But when it comes to Kybella, that's something that I've never personally done. I've also never gotten any thread lifts in my face. face, again, assisted with others, and seen the disasters that thread lifts can be. A lot of people use thread lifts to lift the face. Sometimes they use it to help with fine lines and wrinkles or even collagen stimulation. But if you look at the collagen induction that comes from thread lifts, they are terrible compared to something like a chemical peel or a laser. When you actually look at the collagen that's created by like a thread lift, it's bad. And the barbed ones, again, something I've not chosen to do. Now, outside of that, of course, there are things like hair and lashes. I do get lash extensions and I fucking love them. I have a whole video on that. For me, it's just an ease and simplicity thing. If you are doing things like your hair and your makeup, it's also an extension of our beauty. And that is something that I do choose to maintain and keep up with, even though sometimes I don't always do it as well as I can. When it comes to my hair, I struggle to embrace my natural curls still. Mings by Mel has helped me so much with that. It was just so hard because growing up, again, my father's side has like all the curls. My mom didn't, and I never really had like a curly girl role model growing up. And the closest people in my life were people like Taylor Swift or Shakira. But then Taylor Swift, who embraced her curls for so long, she straightened them out. And, you know, again, growing up, looking at Victoria's Secret models on TV and, you know, seeing these models in magazines, they always had this type of hair. So I do either blow my hair out myself or get blowouts to kind of give me this smooth look, because I was called a ragamuffin, you know, a rat's nest, a frizzball. I was called that all throughout school, and it was rough. I remember my mom like raking a comb through my hair and it just like ripping out. And so I really had a hard time with my curls. And as I've gotten older, I love them and I work to embrace them. But the fact that I'm still blowing out my hair is telling me like, hey, there's something still going on inside your head, Cassandra, and it's not just thoughts. You have like 2 brain cells left. It's not thoughts. Something else is going on in there that is making me reluctant to fully embrace my curls 100%. Speaking of hair, we have spoken about my hair loss. I have never done professional hair loss treatments. I have done things that are over the counter like this. This is the Irie store. Dr. Dre got me hooked on this. This is laser and LED, which we are going to talk about. I have considered visiting Will Gonitz. He's amazing. He's a trichologist here on YouTube. I might go in and actually like, you know, get my blood work done with him and just see what's going on in my scalp, because I am losing hair. It's gotten way better with this. And of course, you know, I'm making sure that my iron is good, my vitamin D is good, is my 1 kidney functioning, all of those things, and we have videos on that. But when it comes to my hair, I do love getting scalp massages. I'm a big touchy-feely person, and I do like my laser hair helmet. And I don't really think that contributes to the curliness of my hair. And usually I'm just like, you know, kind of curling it, blowing it out, and making it smooth. Now, I have done keratin treatments in the past, and I have dyed my hair in the past. I was actually a model for Chi, and I did like runway modeling for like hair stuff, but none of that is left in my hair anymore. And this is all, I think they would call it virgin hair. Is that what they call it? Like it's grown out to the point that it doesn't really, it's just doing what it do. I've never gotten a hair transplant. Depending on what happens with like this little bald spot, I would probably consider it. I would be open to it, but it's something that I have not done yet. Now, when it comes to the face specifically, let's talk about some of those other things like filler and laser and chemical peels, which I have done a lot of. First and foremost, let's speak about filler. I have never gotten filler, hyaluronic acid filler, Juvederm, Restylane, or anything like that injected into my face. It is not a bad thing if you do, it's just a personal choice. There have been times where I thought I needed lip fillers or lip injections. Thankfully, I did not go forward with that. What I actually found is this motherfucker from Amazon. It's an SPF 30 Clarity Lip Treatment. And this plumps up my lips so well. And I can use like lip liner and lipstick to get a look that I want. And I don't actually feel the need to get filler. And then with filler migration, that is something that I worry about. I've seen this doctor on YouTube did MRIs of people who had filler migration. I don't think it's a bad look for some people. They like it. Just for me, it's not something I'm looking for. I've never gotten filler in my cheeks. Sometimes I almost feel that my cheekbones are a little bit high. I'm definitely losing a little bit of volume in like my orbital or eye area. I don't think I would ever get like buccal fat removal. I don't know if I would ever get blepharoplasty, aka like eyelid surgery, but you know, I definitely recognize that my under eye bags, it's not just about nutrition or sleep. Some of my under eye bags are actually those little fatty tissues that are in the eye area, those fatty pockets, kind of pushing through or herniating through like a little septum that's here in the eye anatomy. So in the future, will I change my mind about that? Maybe, but right now I haven't. And again, I've never gotten like an endoscopic brow lift, anything like that. No harm to those who do. It's just something that I have not done. Specifically speaking about nose lifts, oh my God. Specifically speaking about nose lifts as well, or nose jobs, that is something that I spoke about feeling pressure. Again, this was years ago, but like I wanted to work at a plastic surgery clinic. And the one that I wanted to go to was in LA, and they basically made me feel like I needed to get a nose job. Thankfully for me, I never got a nose job. Now there are rhinoplasties and liquid rhinoplasties. Rhinoplasty is a nose job where you are under anesthesia. It is an invasive procedure. There is a lot of healing and downtime, and the nose can change for like a good year before like swelling and everything goes down. And then there is a liquid nose job where, again, filler or like hyaluronic acid filler is actually injected into the nose to kind of get rid of like a nose bump. And for the longest time, I felt like I needed one of those, and I felt like my nose is too big and, you know, whatever. Getting over those insecurities, but I'm learning to love my nose now, and I'm really glad that for me, I didn't go forward with that. For people who have been bullied, or for people who have, you know, felt that their nose is too big or really wanted to change something about their face, sometimes these treatments and surgeries and procedures can be life-changing and give them confidence that they never had. But for some people, it's just another way to try to feed the needs of society and follow trends, and then they end up hurt or unhappy. And again, those insecurities are sometimes still there deep down. And please understand, like with full transparency, as someone who has helped other people and literally worked in professional medical settings, taking people through some of these treatments and procedures and aftercare, I have the personal belief that anyone can disagree with, but I really think that people need to go through some form of therapy or some form of insecurity vetting before someone goes through a procedure to make sure that this procedure is actually right for them. And some doctors and derms and plastic surgeons do require that, others do not. I think that it should be mandatory so that at least people are able to check in with themselves and see, is this just a way for me to physically change my body, to try to patch up a marriage, or to try to feel better about an insecurity that society has made me feel? Or is this something I actually want for me? And again, I'm really happy that I didn't go through a couple of treatments and procedures that I was heavily considering, because I don't think that it would have fixed the issue for me, which was an insecurity issue at the time. Not the same for everyone, and again, for some people, these treatments and procedures can be life-changing, but I do think it's important to note. Now, when it does come to things that I think have changed my face and my life dramatically, I have done lots and lots and lots of chemical peels. And again, when it comes to laser, I actually used to do like laser sales and education. I actually forgot that yes, I have done a laser, although I've done way more laser and assisted with others rather than on myself. Again, I did do Regenlight laser. That was something that I was doing kind of for my acne scars. I want to say, I think I did like 5 or 8 treatments. I was literally someone who was also educating others on this and helping them with it, as well as being a patient myself. But I don't know, again, if it did a ton. Maybe it did. I can definitely see like my acne scars on my cheek versus my chest and my back. And I do think it helped, but I can't say whether or not it like majorly transformed things. Now, while I love laser and I've seen the benefits on others, that's definitely something that I'm probably going to do in the future. But something else that I've done a ton of are chemical peels. I fucking love chemical peels. And there are some invasive ones, like a TCA peel, a salicylic 70% glycolic peels. Again, I've helped with others and I've done them on myself. And when you're doing them with others, like these are major medical peels. We're talking about frosting, skin sloughing off. Some people need to be hooked up to like heart monitors. You need to make sure that you're monitoring patient vitals to make sure that like nothing weird is happening, because it can be intense. Chemical peels are amazing. They are phenomenal at inducing collagen production in the skin, resurfacing, helping with color. There's a lot of aftercare and a lot of downtime though. So yes, I've done lots of chemical peels on myself and on others, but with full transparency, since the beginning of the pandemic, maybe? Yeah, since like 2019, I haven't done a chemical peel on myself other than at-home chemical peels like from The Ordinary or from Be Minimalist. So that is something that used to be like a more regular part of my routine. And again, I still use retinoids, I still use my sunscreen, I use a ton of like over-the-counter products. I have not done like an invasive pro chemical peel on myself literally since the pandemic, but I do think that chemical peels have taken my skin quite a long way. We also have to talk about microneedling. Now, microneedling is really, really good when done professionally and done right, but terrible at home. I have actually purchased little microneedle rollers at home. Do not recommend. Don't do it. Again, unless you're certified with bloodborne pathogen management, don't fucking do it. They are terrible, and I think that they, did more damage to my skin than anything else. Now, professional microneedling is another story. I know a lot of people are really interested in like Morpheus right now. Excellent. For me, I love Secret by Cutera. And with full transparency, I have helped with others professionally. I've spoken at the American Academy of Dermatology. I love Secret by Cutera. And again, Cutera have a bunch of of different treatments, body treatments, vaginal rejuvenation. They sell a whole bunch of stuff, but Secret by Cutera, in my opinion, is amazing. And it is microneedling with radiofrequency. Now, full transparency, I have not actually done that on myself. That is something that I would definitely consider, but if I do it, I'd actually love to take you through it. Like, I'd actually love to show you like my before and afters. I have done microdermabrasion, not medical dermabrasion. Medical dermabrasion isn't that practiced anymore. It's basically, imagine taking like a wire sander to someone's face. That's what dermabrasion is. Microdermabrasion is shooting like crystals or sand at the skin and like vacuuming it back up. I have done microdermabrasion on myself and on others. Most estheticians are trained in it. I think literally, I'm pretty sure like all estheticians are trained in it. It is good, but if you have the money, I would say chemical peels over microdermabrasion. Then there are things like PRP facials or vampire facials. I have helped with others. I've tested it on myself, but I have not actually undergone like a full PRP treatment on myself. I'd actually consider that in my hairline as well, just because plasma can be so beneficial for like hair stimulation and hair regrowth. When it comes to other professional treatments, I have actually done both radiofrequency and high frequency, specifically tripolar. There's tripolar RF and DMA. This is basically radiofrequency as well as like basically like medical microcurrent. Really good for lifting, really good for stimulating muscles and the skin. And yes, with professional radiofrequency, it can get rid of fat or adipose tissue in the face. I don't know if that's done a lot to my face. I look a lot like my ancestors, and so I think this is just my facial anatomy. But yes, I have gotten some treatments. Now, when it does come to at-home treatments, boy, have I tried a ton. I have done professional LED in clinic. Again, I've helped others with professional LED. I've done it myself. I also do LED treatments at home, and I love them. I do use things like my Medicube device. I do use my NuFace device. I do use a lot of these at-home devices for microcurrent. I use my Nebulift for radiofrequency. I like those because I can do those at home and use them every day or once or twice a week and get lasting results. Whereas if I were going into clinic and doing it on myself, first off, you don't have time. When you're in clinic, you're doing other people's shit. You don't have time to like do yourself, and you've been on your feet for like 9 hours a day. You just want to go home and put your feet up and sleep and wash your hands and get the fuck out. It's just, like the people who are doing the procedures literally don't get them that often because we don't have time. But when it comes to getting things done in clinic, it's like you have to go back like every 6 weeks. It's so much easier for me to do those at home. And that's why I like to try a lot of at-home devices. I like to test them out and say, are these things worth it? Because if I can save my money and my time and, have something that is accessible, that is what I would prefer to do. When it comes to radiofrequency and microcurrent and high frequency machines and LED machines, again, I've done all of these both professionally and at home. I do think that they have helped my facial anatomy. I think they've helped my skin. I really do like them, but I don't think that they are the same as obviously like chemical peels or lasers or obviously like liposuction, right? Those are much more invasive, whereas the at-home stuff is much more accessible. But I found that the at-home stuff can be hit and miss depending on what you get, and you have to be consistent with it. And if you have to show up to a clinic and pay a bunch of money, that gives some people accountability and they will do it. Whereas if they buy it and bring it home, they'll just forget to use it. If that's you, then maybe doing the professional stuff is literally going to be better. And if you don't know if something works or not, get it done professionally first, learn how to do it, understand the science, ask the questions, and then see if an at-home maintenance device would work for you. And that's why I like to review a bunch of these different products and tools and show you before and afters. Like, we've done them on the NuFace, we've done them on Medicube, we've done them on LED treatments and on at-home chemical peels. Please watch all of those. Again, I'll list them for you because those have been monumental for me, and that's really how I've kept up my skin treatments and my beauty, especially like since the pandemic for like the last 3 years. There's also things like hydrofacial. Yes, I've done hydrofacial as I guess you're not a patient when you do hydrofacial. I've done hydrofacial as a client as well as for others. I love the hydrofacial. It's just such a fun visual, and it's like getting wet, smoochy kisses all over your face. Yes, I have gotten some amazing facials in my life, and massage. Honestly, massage is the best part of a facial in my opinion. But again, I'm a very touchy-feely person. And with all of these things, I feel like it's not about capitulating to the needs of society or changing yourself for something else. Whereas when I was younger, I definitely considered a lot of, if not all of these treatments, thinking I needed them to be beautiful. And I don't. I am beautiful just the way I am, and I can choose to enhance certain things or do my hair or do something different without having to fundamentally change who I am for somebody else. And that's the biggest question that I ask others, and I want to ask you. It's like, if you were to get this treatment or procedure done and nobody could see you, would you still want it? If you were an invisible person, or if people only saw the picture of you that, was you before your procedure, would you still get it for you and how you feel in your body and how you look in the mirror? And if the answer is yes, then absolutely do it. But if the answer is no, or maybe, reconsider it. Again, I think therapy is so incredibly helpful, and our mental health, our inner narrator, literally that voice inside of our head dictates everything we do every day. And if we don't start with this, then none of this matters, right? You've seen people who maybe aren't the typical vision of beauty, but they have this inner light or this confidence or just this charisma to them. And they're the most beautiful, kind-hearted, amazing people in the entire world. Again, everyone's opinion is different, but if I had a choice, I would be much more attracted to and like to hang around with and like to be that person that is bringing that light and that vitality, and yes, has a gummy smile or fatty pouches on my tum-tum or my arms or whatever, and my hair is falling out. I'd rather have that than this, perfect magazine, model, Victoria's Secret body face, that is quiet and reserved and insecure. Because at this point in my life, I've come to terms that the feeling is more important than the facade. Oh God, I just wish I could go back and tell 16-year-old me that. Again, I might change my mind in the future. Humans are resilient and dynamic. Maybe I'll go get some of these procedures in the future. But if I do, I will maintain transparency and authenticity about it, because those things matter to me. And in an ideal world, I'd love to take you through those things if I ever choose to do them on myself. Do you want to come with me to do some chemical peels or some hydrofacials? Let you go know. There are so many videos right here that I will link for you. I'll also link in the YouTube little tab where you can see some of the at-home treatments that I currently do and recommend, because again, some at-home treatments are very scammy. But remember to reapply your sunscreen and use a retinoid. That is literally the best thing you can do at home, and that's something I do literally every day. So be beautiful both inside and out. I literally mean that. Check out the links in the description if you think those will help you. And if you've tried any of these things, or if you've had an experience with fillers or treatments or plastic surgery or injections or over-the-counter products, leave them in the comments below. And I hope that this video has shared my journey in that with you, and that we can read more in the comments together. There's also more videos right here. I love you, beautiful butterflies, and I can't wait to see you in this next one. Love you guys. Bye.